Set both of your arms overhead and then pinch them back down. Okay, so, and then have your hands just rest by your side. And so this is a chance while your client's getting comfortable to start with number one, assessing. You're gonna examine the alignment of the shoulders. Is one lifted up higher than the other? Do you see anything lifted or shifting to one side versus the other? Any joint rotation? You know, I noticed like a little bit of forward shoulder on the right. The left shoulder seems to be sloping off a bit less, or probably a bit more than the right hand side. The left arm seems a bit more comfortable further away from the body, and the right side seems a bit more home, closer. Pretty even in terms of elevation of the shoulder, things like that. Other clients are going to have different asymmetries to pay attention to. Okay. And I'm just going to have my phone here so I can reference the sequence myself. So parallel shoulder hold, creating contact, gently sending pressure downward. Maybe you rock from side to side. Parallel shoulder hold. And then beginning, I'm going to start with Jamie's right hand side. So beginning with light MFR, moving across the clavicle towards the deltoid tubercle. So finding that little bit of pressure, trying to find the tug, and then just gently moving laterally, encouraging the client to breathe. You can take some deep breaths as we start to warm up the tissue. Feeling for any adhesions or restrictions along the way. You can use your palm, you can use fingertips to get more specific. A little bit of light myofascial release. Another thing that I want to show you that you could potentially do as myofascial release is use your opposite hand to encourage some of the tug that you're trying to make happen while you're working here. So you move a little bit and then you tug the tissue. How's that feel, Jamie?
That's nice.
Okay. And you just reset and tug the tissue. To the deltoid tubercle. Moving to the next one, a little bit of light effleurage to warm up the area. I'm just gonna put my phone next to your head there. We're gonna be working with the whole arm, so effleurage across the chest, down the bicep, coming to the same side, working a little bit on the muscles of the forearm as things start to warm up, moving in the direction of the flow towards the heart. I'm noticing a little bit of tension. Ian, let's try to wake up, please. Noticing a little bit of tension in the bicep area I might want to focus on later. I'll move into the traps because we're going to work on those later too. As you do this work, you can check for any blemishes, any bruises, localized warmth where things feel warm, where the blood's already flowing. I find that the book doesn't highlight a lot of petrissage. I don't know if you've worked with a lot of petrissage, but I really enjoy it as both a palpation tool and a warm-up tool. So you can use some petrissage, especially here in the traps. starting to work with the anterior deltoid, alleviating any forward rotation. Remember in the beginning I said I noticed that Jamie's shoulders on the right seemed like it was rotating a bit more. After just a little bit of work, we can see not only do they look more even, but the right ones also sort of drop down below the left. Sometimes it doesn't take that much. So stripping along the anterior deltoid. A little bit of friction, circular. Transverse. How's the pressure feeling?
It's good. It's pretty sensitive.
Pretty
But
sensitive.
It's not like
Not being
near the threshold.
Okay.
It's just like
Easy stuff you already know. Now getting into some insertion points. This is more palpation than treatment of the rotator cuff muscles. So first checking out supraspinatus, getting into the tissue here, sinking below the traps. If I have any difficulty in trying to find supraspinatus, what action can I ask my client to do to activate that? That would be more trapezius. That's it.
Abduction.
Yeah,
Sorry.
a little bit of abduction. Yeah. So you find a generalized area, provide a little bit of resistance, and like your hand is the arm of a clock, and you try to bring your hand towards the windows behind you. And you resist. Supraspinatus doesn't feel like it bulks up against your pressure, it just kind of slides. Go ahead and relax. And then you feel it as they let go, the muscle kind of soften underneath your fingertips. Any tenderness while I'm working right here?
yeah,
A little bit. As you move more laterally, supraspinatus is more difficult to feel and also becomes much more sensitive to the client.
yeah. It's definitely
More tender, more laterally.
more lighting up more over there.
Okay. Working underneath for infraspinatus, checking out the lateral border of the scapula and knowing that anything underneath that flat surface of the scap is going to be the infraspinatus. You're checking to see if there's any adhesive tissue and checking in about any areas of localized tenderness. Feeling tenderness here in this area?
Yeah, a little bit.
A little bit. Then moving laterally closer towards the insertion. Tenderness right there, more or less. Okay, not so much with infraspinatus. Sorry. And then checking out teres minor. So light abduction, revealing some more of the tissue here, tucking. We know it's the upper 2/3 of the lateral border of the scapula. Here we go. Ah, nice. All right, what about here? Not too bad. You can encourage some lateral and medial rotation as a palpation tool as well, seeing how things feel, what feels restricted. There's a little click that we keep
Yeah,
feeling here
little
together.
crunch.
Yeah.
I feel that at the gym too. Like always clicks.
Okay. And then subscap is going to be moving the lat out of the way, sinking down onto the anterior surface. Can we all see? Okay, we're moving. Maybe encouraging a little bit of medial rotation. And how's the zone feeling? And a little bit of medial rotation here too.
It's fine. I'm also like slightly numb there, so it's kind
Okay.
of, like hard to know. But
Oh,
it doesn't feel-
where's the numbness stemming from?
a surgery?
Surgery.
It just sounds like
Post-surgical numbness.
yeah.
Okay. All right, next up. Biceps. So, working the bicep muscle, coming back to your effleurages, lengthening the bicep up the shoulder. You can use the tips of your fingers or you can use the heel of your palm. Moderate amount of pressure. How's this feeling?
It's good. It's tender, but it's good.
Tender but good. Just moving along the length. Feel free to use your thumbs as well for something more pointed. With your thumbs, you might be able to feel that long head of the bicep tendon as it moves up to the supraglenoid tubercle. Feeling for any restrictions. Okay. Next, you can pronate the forearm. Start to work with these extensor muscles. Again, you can use fingertips, thumbs, heel of your palm. Just waking up the whole arm region before starting some more specific work. Strokes that incorporate both sides of the arm, moving from inferior to superior on the front side, superior to inferior on the posterior side. Once it feels like this arm has been warmed up properly, you would repeat on the other side. I'm going to skip that, come back to the head of the table, giving the posterior body a chance to relax from this position. Starting to work the traps. First spreading the oil, and you can use fingertips, you can use soft knuckle. Noticing where along these lines do you feel restriction. Working underneath. To rhomboids. As you trace up rhomboid, maybe you feel levator scapula. Back up to these neck extensors. And just encouraging the tissue to soften to prepare for some deeper work. Little ridges and bumps you feel along the way. Again, don't be afraid to utilize a little bit of petrissage as a transition. Also to start to work with trapezius in a bit more targeted ways. You can tell which parts of the anterior lip of trapezius feel toned with this petrissage stroke. Spend a little bit of time with the pincer grip. Take a deep breath. And let it go. Okay. Let's see what else is in this sequence. Okay. So once things are properly warm up, then we can get into joint movement, just checking all the ranges of motion. A little bit of stretching, but not too much, okay? You'll check for lateral rotation. Medial rotation. Horizontal abduction. Is this feeling okay?
A little nervy.
A little nervy.
Yeah.
Feeling nervy, we just back out a little bit. Try not to have the elbow too extended. Less nervy?
Yeah.
Okay. Checking out full flexion, full abduction. Does it feel okay to have your arm in this position?
Mm-hmm.
Okay. A little bit of a push downward. Take a deep breath. And exhale. Shoulder protraction. A little jostling. And then if you felt like there were specific sites where there may be some trigger points, you go ahead and work with those zones. We didn't do anything too specifically with that, and that will just be the general sequence. Opening up the anterior chest, moving down the arm, coming back up the arm, addressing the posterior side from the supine position, then stretching the joint out, checking back in about any areas that felt toned, and then moving into whatever sort of specialized protocols you want to get into. Cool? So, specific techniques here. I just want to highlight what the subscapularis. So, what you'll do is gently bring the arm into a little bit of abduction. Access this tissue from the axillary area. You may want to lift the arm up a bit, sink down. Often your client will respond with a little bit of tenderness. That's how you'll know when you're in the right zone. Jamie mentioned that he feels numbness in the zone, so probably not going to notice as much tenderness, but you would just use some static compression here on this area for anywhere like 10 to 15 seconds, encouraging your client to take some deep breath. Still feeling numb?
I feel it, but it's not tender at all.
Okay. And then this one is not coming into your textbook, but I want to show you something that you can do, a little PNF, to engage with that idea of PIR. Do you remember what PIR stands for? Post-isometric relaxation. Okay, so you'll move your client's arm with you still holding onto this subscap tissue across their body within their level of tolerance, and ask them, can you place your palm on your opposite shoulder? If they can hold that position and there's not a whole lot of tenderness where you're working, then encourage them, go ahead and straighten your arm and reach over to your left. So now we've gotten into this isometric contraction of the subscap. You can hold that for 3, 2, 1, and release. And as they release, you can sink a little bit further into the area and repeat as necessary. How's this feeling?
It's nice.
Feels nice. Okay. Coming out. Could be really sensitive work, so go slow. Maybe encourage them to take one more deep breath and slowly release as they inhale. Go ahead and exhale. Cool. Subscap. All right, let's see what's next here. Active engagement shortening of the biceps brachii. Cool. So Jamie, what I'm going to have you do is very moderately placed, kind of slow. You're going to flex and then extend. Go ahead and do that for me. The first couple rounds is your chance to notice if there's any restrictions in the movement. One more time. And you're looking pretty good. And now as you continue that, I'm just going to start to do some work as you bring your forearm closer to you. So go for it. As he engages his bicep, I do a little bit of compression broadening. And as he goes back into extension, I let it go. And I move a little bit up. Same thing. Compression broadening. So asking them to engage the muscle increases the amount of sensation that he's going to get from the pressure without having to add too much force yourself. And you would just gently do that all the way up. Go ahead and relax. Moving into pin and stretch, you passively move into flexion, find an area that you'd like to work on, and then passively move their arm into extension. You can do this a couple of different ways. You can just systematically move up the arm. Pressure feels okay. Or you can find the tissue that you want to work with and then gently move along the entirety of the muscle as you move into extension. I'm localizing this demo on biceps brachii, but you can feel free to use pin and stretch techniques anywhere you'd like. Okay, and I think we're into active lengthening. So now, I want you to try to bring your palm to your shoulder, but I'm going to resist you while you do that. Good. So we've engaged the muscle, and now I want you to slowly start to bring your arm to straight. As he does that, there's an eccentric contraction of the biceps, and we can start to lengthen that muscle with some deep stripping. Time, trying to bring the arm into flexion and release. Eccentric contraction of the biceps. Perfect. Okay. So now, I'm just going to redrape his arms. And we're going to move into a prone position. Oh, thank you. So we get full strap your leg. Let me get this. Okay, what do we got here? Deep stripping of infraspinatus and teres minor. First we undrape. And I'm gonna have you hang your arms off to the side of the table. And just because I was working on the right, I'm gonna continue working on the left. Right, new side of the body, haven't worked with it yet, just want to do a little bit of effleurage. Okay. So I know that infraspinatus is this area of tissue just behind the scapula, right? So supraspinatus is over here, infraspinatus is over here, teres minor is over here. So I'll start with some thumb pressure and gently move towards its insertion point on the humerus. How's the pressure, Jamie?
That's fine.
It's fine. can use thumbs. You can use a soft fist. You can also work on the opposite end of the table using fingertips. Moving towards the humerus. Infraspinatus is a fairly wide muscle, so feel free to work at different angles to access all the tissue. Deep stripping. To work on teres minor, you do the same thing, but you can, excuse me, work on this side. Yeah, so you'll find that upper part of the lateral border and work deep into there. Tyler, stay with us. If you find that your client's shoulder starts to move as you're working with them superiorly, you can stabilize their shoulder by holding it. Okay. Going into a little active technique, you can passively move their arm into lateral rotation. Jamie, I want you to hold that right there for me. And you notice all of his external rotators working to hold the muscle there, infraspinatus, teres minor. Establish a little bit of pressure where you feel the most contraction. And now, Jamie, you can slowly release your hand and forearm down towards the ground. And as he releases, the muscle softens, working with the muscle neuromuscularly. And one more time, let's lift up. Hold for 3. This time I'll work on teres minor. 2 and 1. Go ahead and release. When you reach the bottom, go ahead and take a deep breath. And release. Nice. Cool. Let's see what's next. Okay, this is going to be stripping of supraspinatus. So, like your petrissage maybe helped you find, you're gonna feel for this anterior lip, and you wanna move deep to that lip of trapezius into the supraspinatus muscle. In this prone position, it's really easy to know if you're engaging supraspinatus by asking your client to gently press your elbow up against the pressure of my hand. And then you'll feel supraspinatus right underneath your finger, and relax. And then you move longitudinal, right, deep to trapezius, supraspinatus. And also in asking your client to do that work, one more time, push up against my pressure, you can turn it into an active engagement technique. And release. And one more deep breath. And exhale. And once you've done that work, make nice to the area. Check for some neck tightness too. Okay. Last little sideline thing, and then we will get into our pairs. So, Jamie, can you please scoot down and roll over onto your left side? Perfect. And then send your right arm up. You can offer them a little bolster for their head. There you go. And then, if they need it, a bolster for in between their knees. Perfect. So your textbook has you working on the traps by starting at the head of the table, finding that trapezius muscle, establishing some pressure, and moving downward. Following it all the way to its insertion point at the acromion process, like so. I'm just using my opposite hand here to get some movement, so I'm not just pressing into his tissue, but also assessing which direction it's moving in and wants to move in so I can trace it more easily. Is this all feeling okay, Jamie? Okay. But alternatively, like not on the textbook, lift your arm up. I'm just gonna hook your elbow with mine. Okay, so now I've got free range to move the shoulder however I want and to work with it in a different direction. So I'm gonna sit on the table, wait for the arm to relax, take my fingertips and strip. I guess it's the same direction, but now I'm using my body weight instead of pressing. Ooh. Yeah.
What was that?
That feels more like a levator scapula. Taking the tissue, scooping it,
What did you feel?
leaning back. It was like a guitar string that I strummed across. You felt that again? A deep breath. And exhale. Let's see, is this levator scapula? Try to bring the shoulder up towards your ear. Good, and release. And now try and lift your head up off of the bolster. Okay, go and come down. One more time, shoulder up towards the ear. And let it go. Okay, so I did not feel anything when I asked Jamie to do lateral flexion, so I ruled out a scalene, but I did feel contractile tissue when I asked him to lift his shoulder blade up towards his ear. So my greatest clinical guess is that that was a tight levator scapula. Continuing to move on. And then from this position, I can also cup onto the shoulder and just lean back for a nice stretch. Okay. Just bring your arm down together. Great. Thank your client, finish things up. And let's start to work together, okay? So come into pairs, play with that sequence, work on those specific areas from the textbook. Feel free to adapt them for zones that you feel in your client's body, and come seek me if you need any questions, okay?
Thank you.